Good evening, Sturgeon Bay and Door County. Welcome to our Facebook Live. I'm Dr. Jim Heise, Chief Medical Officer here at Door County Medical Center. I'm joined, as always, by Sue Powers, who is the Door County Public Health Nurse Manager. Did I get that right?
Almost.
Fix it. What did I want?
My title is Health Officer and Public Health Manager.
I'll never get that right, but that's
No,
a much better title than
while.
I said. Yeah.
You were real good, though.
Yeah. So thank you all very much for joining us. We hope to answer as many questions as we can. I think tonight we're going to try and end this at about 6:45, if not sooner, depending on the demand for questions and things. So what we'll do now is, just like we do each week, this is becoming a thing. So what we'll do this week is as usual, we'll have Sue start out with kind of an update, and then we'll talk about some topics as we're waiting for questions. And as usual, I'm going to be fumbling with my iPad to get ready for questions.
Okay, thank you. First, I want to say again, thank you to Door County Medical Center for hosting this and inviting public health to be a part. It's so great. Love having a conversation to get some information out to the community. So I'll start out, like usual, with case numbers, although I always say this, I don't want you to focus too much on the numbers. But fortunately, we're still at 9 positive confirmed COVID-19 cases, and we know from our follow-up and investigation that 6 of those have recovered. They've been released from isolation. There's been just 1 death. Negative tests are 190. And we have 18 tests that have been done and are still pending. So that's really all my update.
They're getting shorter, which is good.
I guess.
Because, as you know, it is one of those no news is good news type things. There's a couple things that we thought we would cover tonight before questions start to arise. And one of the things I guess to point out is that we've noticed, and I think health systems across the country have noticed as well, that people are not, they just aren't coming in. I mean, if you're sick, people are trying to avoid accessing health care. And that's completely understandable. I understand. I think people have the idea that coming in here and into the medical center is probably the focus of infection, and that the risk of getting infected here is high. And I guess the message that I want to send is, we're here. And if you aren't feeling well, if there are issues that you have concerning your health, if you need to see your primary physician or clinician, please call and make an appointment. You don't have to hesitate. We keep basically the area that would be involved with COVID, we keep that area sort of segregated from the rest of the facility. So the facility is meticulously cleaned, it always is, but we're very aware of that. It's very safe to be here. So, I don't say that because I'm looking to drum up business. I say it because you don't need to be afraid to come here. If you need to, if you're not feeling well, by all means, come in and see your clinician because we are here for you. So that's the first thing. Can I hand something off to you?
Okay.
Go for it. Do you want to talk about something?
Well, before I came here, I was reading Governor Evers' announcement with the Badger Bounce Back Plan, and I can't say that I have digested it enough to talk a lot about it, but I think it's really hopeful for all of us to think that we're going to ease into some semblance of normalcy and to work towards that. The virus is here, and it's going to leave on its own timeline, not on Governor Evers' timeline or my timeline. And we got to remember that limiting physical contact is really our only tool to slow the spread. There's no treatment, right? Mm-hmm. Although you're trying some innovative things, I hear. Mm-hmm. And there's no vaccine at this point. So it remains on all of us to do that social distancing and keep hand washing and wear masks when in public, and all those things we all have been too familiar with.
Here's a good question. So, Sue, you said we've been holding at 9 people with positive results for 5 days. Just stated 6 of those have recovered. Are those in the 9 people? Yeah.
Yes.
Yep,
Mhm,
they're
that's what I
inclusive.
meant.
That's
Right.
total of 9, and
Mhm.
6 have totally recovered. Is that also going to lower the total positive? No. I'm not sure I understand that question, but no. Mm-mm. Are you seeing less calls to the COVID hotline that we have here and less tests being done at the testing site? And the answer is yes. We're seeing less calls, and I wouldn't say right now we're testing less, mostly because with guidance from the CDC and just our own experience, which we now, we've got we're a month into this, and as we do things, just like any other healthcare organization in the country, we're learning a lot as we go. So we are opening up our testing more. So basically, if a person has any symptoms, specifically if you've got fever or you have cough, a headache, anything that could be a viral illness, we're at the point where we are able to reasonably test, and we will do so because we really want to know if there's more around than the numbers would suggest. And that's nationwide, that isn't just here. So yeah, we are seeing a decline. Let's see. I think before we go to more questions, I did want to mention with regard to the hotline, we do have telemedicine visits, which will be starting up later this week. And what that basically is if you're a patient here and you have access to our portal and you've signed up for the portal, you're able to actually go on, make an appointment for yourself, and you actually will be able to do an on-screen visit with one of our nurse practitioners. And right now, it's not a general health visit. It's just for COVID screening. So just like you're calling the hotline, if you have concerns, if you think you have symptoms, if you have questions, you can go on and you can actually speak live to a nurse practitioner. If anyone's familiar with FaceTime or Skype or Google Duo, it's that same thing. It's like FaceTime. You're actually speaking to someone. So we encourage you to make use of that if that's helpful. Also, I had a request. People have sent me an email and said, could you please show folks how to wear a mask? Because apparently the people that sent me the email have said they've seen people with all different ways of wearing a mask. And, there's no shame in that. I mean, most of us don't have to wear masks. And so why would we know how to do it? But what I'll do is, this is my mask that I wear every day. I don't wear it here because Sue and I, you wouldn't hear us as well if we talk through this. So in this case, this is not like a cloth mask you would have at home, but it's the same basic shape. But what I'll show you about this mask is what we use. In this case, the colored side is out, and the top part of it has kind of a little metal thing that allows us to pinch around the nose. And so you put it over the bridge of your nose, over your ears, and then you pull down. So the key is to having it on the bridge of your nose and having it over your chin. So you don't want it like this, and you certainly don't want it like this. That doesn't really help you a lot if you're doing that. So just having it on like that makes the most sense. And don't worry about the fact that you can get in the side. People say, oh my God, I can feel the air coming through the sides. Doesn't matter. That's not going to, again, we're talking about things coming right at you as far as spit. So that's the mask demonstration. Was that at all entertaining?
Nicely done.
Okay. If I'm good for nothing else, it's comic relief. Of the 9 positive, is the death part of that? Yes.
So maybe I should explain a little better about case counts.
Yeah.
So we're at 9. If we get more positives, it'll go up. It is never going to go back down. We're keeping a cumulative count, and that's how the state is doing it too. Cumulative count of how many cases we've had since the start of this. And then the other numbers, 1 death, that's included in the 9, and the 6 that have recovered are going to be included in the 9. So for our case count, it might vary a little from Door County Medical's count if they would have a resident from a different county here that they tested. That would be in their count, but it wouldn't be in ours. The Door County Public Health count is just residents of Door County. So if somebody from Green Bay comes here to get tested, we don't count it. We'd certainly communicate with Brown County. Door County Medical Center would do that also, or if the person was staying temporarily here, we would certainly follow up with them. But it wouldn't be included in that number that we use for our case counts. I hope that helps.
Let me just look. I'm just kind of breezing through some questions here. Do we support that it's mandatory for essential businesses include in their COVID-19 response plan to basically require wearing masks while at work, even if they're homemade or at least a bandana?
That's a good question.
Mm-hmm.
I don't know that I have an answer for it. It all depends on the work and
Yeah.
how many people are around and all of that. I mean, certainly at a dental office, it's going to be different from a hardware store.
I mean, I think, yeah. I mean, I think in general, I think my personal take on it is everyone should wear a mask when you're in public. You just should. Mm-hmm. That's an easy way to basically, as we've said in previous weeks, keep your spit to yourself. I mean, that's the best way to do that. And obviously social distancing. So at work, at essential businesses, sometimes staying 6 feet apart isn't as easy as others. But I think at least wearing a mask will help that situation. So I would say, yeah. I mean, do we as the hospital have any ability to enforce any of that? No. But I think, you know, there's a lot of conversation that happens with different companies and with folks around the community where we do try to at least recommend what we think is the best possible course of action on that. Let's see. Why do we send positive cases to Green Bay? We don't, and we haven't. So I think there was some question about the first one was in Green Bay or something, and we didn't. And there's details behind that I'm not going to get into, but we haven't sent anyone that's positive to Green Bay. Other communities are sharing general details on the COVID cases, such as age or demographics, without violating privacy. Why is it that we don't? You know, I think both Sue and I had kind of agreed that, you know, I don't know that it helps anybody to know that. I mean, you know, we could, you know, I guess we've had a range from anywhere from, see, I'm forgetting. I want to say early 30s all the way up to over 80 as far as the types of age. But as far as demographic information, we're certainly not going to tell you what street they live on. I mean, you know, heaven forbid you get some kind of embarrassing infectious disease, and would you like us to advertise that? Probably not. So not that COVID is an embarrassing disease, but Sue knows what I'm talking about. I have examples that we giggle about.
So I would also comment that when public health reports information about different disease cases, we're very mindful of reporting so that things aren't individually identifiable. If you look at the Wisconsin Department of Health Services website, they do have a map and they show all the counties, and you can click on Door County and you can find information about the cases, but what it will say is less than 5 cases. It doesn't in a census tract. It won't give you the number because there's less than 5 and it makes it too identifiable. And the same goes for anything we'd divulge regarding specific ages or race or gender. It simply makes it too identifiable in a small population with a small number of cases. And Dr. Heise is absolutely right. It's really not going to benefit anyone.
Yeah. This is a good question. Why are visitors not counted not counted or included in Door County numbers if they're tested positive here? And I'll try and answer that, but Sue, you could certainly chime in. And I learned this from Sue, which is I guess why I'm answering, which is if someone's place of residence is in a different county or a different state or any of that, or a different country for that matter, it gets reported that way. Mm-hmm. Is that right?
Correct.
Yeah. So
But having said that, if they are really from, I don't know, the state of New York, and they're here for 6 months, they have a temporary address here generally, and we'll put that in, and we'll count that as a Door County case. But if somebody is, well, nobody should be traveling right now if it's non-essential, but if somebody is just traveling here for the weekend and they test positive and they're going back or whatever, they're just here very temporarily, that's not in our case count because they're not a resident here.
And Bailey asked the question, can we be told how many people that Door County has tested that are not full-time residents? And honestly, I don't remember. I mean, I think if I did, I don't think I'd have a problem saying that. I don't remember. I think the vast majority, my sense of it is the vast majority are locals. And so, you know, obviously I can think of a couple that are more like Sue had said, that live a good part of the year somewhere else and live a good part of the year here. So they really are residents. But that's the best way I can answer that.
I can add that the 190 negative test results that we have are from people that have a Door County address. They're not from elsewhere. But I can't guarantee they don't live somewhere else part of the year.
Right. Amanda asks, do you have concerns about our numbers spiking given the growing amount of positive cases in Brown County and the number of people commuting or traveling from Green Bay? I think if I answered anything other than yes, I'd be foolish. I mean, obviously that's paramount on our mind. The one thing that I know has been said on the media in Green Bay, so I wouldn't be saying anything wrong, is that all these cases that are right now are a hotspot related to a business in Green Bay. So I'm less concerned or worried that they would be coming up here because all of those that have been identified, they've been met public health and they've been given the appropriate quarantining type things. And so I don't have immediate fear of that, but obviously that's a huge consideration, and it's only 45 minutes south of us, so that's why we have to continue to be cautious. And again, we harp on this, the basic tenets: social distancing, washing your hands, coughing into your elbow or into a tissue. Don't touch your face, which I know I probably do about 10 times over the course of these Facebook Lives, and we all do. Cleaning surfaces, things like that. Those are all good things to do in general, but most certainly they're important for this. They also play a large role in Governor Evers' Badger Bounce Back. I had a chance to read it, as Sue mentioned, and that is a big part of it. And if we'd like to sort of be able to lessen some of the stricter stay-at-home policies, we all have to become really good stewards of that. Let's see. I know I saw earlier, and I wanted to address it. Someone said, "Are we doing antibody tests yet?" The answer is no, but it should be coming. And there's lots. I know. I'm sure people have seen the news. There's lots of antibody tests that kind of are using the pregnancy test model. I mean, we've seen these little plastic things where there's a depression in one end, and then there's a plus that lights up, and it's a drop of blood that goes in there. There was a lot of them that were initially sold and touted from China. Turns out they actually don't work very well. It's not just a matter of getting those tests, it's also a matter of deciphering what does it tell us, and we know basically what it tells us as far as has someone been exposed or been infected or recovered, but how rigorous and how sensitive and specific are the tests? When we say how specific is a test, we're looking at does the test have a lot of false positives? So if it's not very specific, you can have false positives. When we look at something being sensitive, how many false negatives will it give you? So if a test is very sensitive, you won't have very many false negatives. Likewise, if the test is very specific, you won't have a lot of false positives. And that's always with any test that we do, blood work, any of those things, that's a big piece of it. I think eventually antibody testing is going to play a huge role as we begin to look to relax some of the I guess lockdown, for lack of a better term. We look to relax those. Antibody testing is going to play a big role. So I know, I guess I'll take this opportunity to make the comment. I know we've seen over the weekend protests and things like that to sort of basically let us go about our business and stop the economy. What I would say is, I completely understand, I think, where people are coming from. I think, people that maybe have lost their jobs or are furloughed and they aren't making an income, this has got to be absolutely frightening and maddening. And so you look to do something, open this back up, open us back up, so that we can get back to doing our job and making a living again. I completely understand that. I think, though, if we can be a little bit patient and just wait for the next couple of weeks, so really, Governor Evers' initial order was going to expire later this week. And so even if we wait till May 1st, I think if another week or two, we're going to see a lot more progress as far as antibody testing. We're going to know a lot more about what's going on. It feels right now, other than a few hot spots, it feels like we seem to have gotten over that hump. I'm always a little cautious saying that because, the minute we say that, it feels like something will happen. But I feel like if we just give it a little more time, I think we'll be able to get past this. And the big concern is what we don't want to do is flung open the doors and everyone go about their business and go to the movie theaters and things like that. Because if we do, the odds are very good that we'll have another resurgence. And not that won't happen anyway, but we need to be able to be prepared for that resurgence and be able to react quickly and decisively in a small group. So we can pick out hotspots, we can test, we can do contact tracing. So it's going to be a lot of work for public health, things like that when that happens. So if we can just give it a couple more weeks, I think we're going to know a lot more. Anything you want to add to that?
Well, what I've been reading from the state literature and the scientific data tells us that if we can allow the curve, as everyone has talked about, to flatten for 14 days, we'll be in much better shape to relax some of the restrictions. And I know it's hard to be patient. I understand. I'm empathetic to people's frustrations. I'm pretty tired of this myself.
Oh my gosh, yeah.
But obviously I still have a job that pays me, so I'm really fortunate. But for the health and safety of everyone in our community, we have to stay the course as much as we can.
Absolutely. This is a good question, and I think it allows me to sort of inform people about some of the neat things that we've been able to do. For those that, when I first moved here 10 years ago, I always heard that this was sort of the small hospital that people didn't want to come to. And where I grew up, which is a suburb of Milwaukee called Menominee Falls Hospital was one of those hospitals too, that you don't go to Menominee Falls, go somewhere else because it's really bad. Well, now Menominee Falls Hospital is part of Freighter. They're a 5-star hospital. We are also a 5-star hospital. So what's really exciting, someone asked the question, have we collected any plasma and have we treated anyone with convalescent plasma? Convalescent plasma, if you haven't heard of that, is basically plasma is the liquid component of our blood. Convalescent plasma is plasma that has been collected from someone that has recovered from the disease. And the concept is, if someone's recovered from COVID, they have developed their own antibodies, and the plasma will have those antibodies. And so assuming the blood type is a match, that could be transfused into a patient who is suffering with COVID, and the idea is that perhaps the antibodies will help fight off the disease in the acutely ill person. Have we collected it from people that have recovered? Yes, is the answer. We're actually part of a study with Mayo Clinic that we're involved in. We actually have used convalescent plasma on one of our inpatients, which is really kind of exciting. We also are using relatively kind of high-tech therapy on our sick patient that is in the hospital. We're using a blocker of inflammation that is used in the academic medical centers, and we've used it here as well. So, it's our chief hospitalist, Dr. Mark Bernard, has been on the case of these patients for the last 2 weeks and has just been doing an amazing job, and along with our team of nurses who have been taking tireless care of our patients, and I just can't say enough good about what they've been doing, and just to congratulate them. We're doing things in this hospital that I never would have thought from a critical care perspective, and that's pretty impressive, and it's pretty humbling to be a part of an organization. Not to toot our own horn, but as a physician, it's kind of exciting what we're able to do. Let's see. Someone had asked the question concerned about food safety practices. I think someone has said about drive-through. Where was it? I lost it. I think it was a question about drive-through fish fries or something, and I think I'm sorry, I can't find the test, but the question. I know my family's been doing a lot of takeout, and I have no concerns, and so I don't think that that's a huge issue. But
no, and I think you went into this last week a little bit and talked about the common sense things, like when you get home, take it out of that container, put it on your own plate, and use your own silverware, and wash your hands in between, and all of that.
Yeah.
That would be the safest practice.
This is a really good question. Amy posed it, and I appreciate it very much. Should all door residents be tested now for antibodies, or even perhaps asymptomatic? Is there an adequate supply of tests? So a couple things related to that. What we're finding is that people that don't have any symptoms at all, the yield of testing, at least for the DNA, the PCR we call it, that test is not very high when someone does not have symptoms. As a result of that, we're not recommending, and neither is the CDC, doing mass testing of the actual detection test, detecting the virus. Do I think we should be testing a lot more? Heck yeah. Am I looking forward to doing antibody testing? Yes. Once we get that up and running, we absolutely should. Testing, as far as are there enough tests, that's always interesting, because we hear on a national level that we have all kinds of testing, no problems with testing, any of those sort of things. Well, I think in the local circles, we're not seeing that as yet. Not that it's not coming, but we actually are pretty well set for tests, at least here. But for widespread testing, I don't think anyone is there yet. Widespread testing is part of the governor's, I always have to look, Badger Bounce Back, quite the alliteration there. He's looking to do more widespread testing, so I expect that we'll be seeing that. Someone had asked too, I'm sorry.
Although we've been saying that all along, everybody wants to increase testing.
Right. Someone had asked too about our in-house testing and how is that going. It's been going very well. If anyone comes here and requires admission to the hospital, we test all admissions to the hospital prior to them going upstairs, so we know if they're positive or negative, and that's been a real helpful tool to have. So we're able to know exactly where to if we put them in our isolation unit versus our regular medical, surgical, or ICU area. So that's been going very well. We don't have an unlimited supply of that, unfortunately. We get about 60 tests a week, if that. We actually got no tests last week from the company, so we're doing our best to be very careful about who we use those tests on and under what circumstances. Are we seeing heart and clotting issues with COVID patients? Absolutely we are. There's a lot that could be unwrapped by that, but yes, we're seeing, pretty much what our experience has been is a lot of what we've heard about and read about and seen in larger centers, we've experienced it here. And what's the interesting thing is we literally are learning as we go, as is everyone in the country. We're learning as we go. This disease affects people in ways that we've not seen in other patients before. We have similar looking situations, but these people are very sick, and the virus, it's either the virus or the virus's impact on the immune system is affecting multiple organ systems, and it's I guess the only word is scary. It's really scary how this goes after the body. Let's see.
I think your comment about we're learning as we go is one of the great frustrations that we get comments about.
Yeah.
People want to know when this is going to be done. How is everything going to change back? And we're learning as we go what's going to work. What we're planning, and even Governor Evers' Badger bounce back, what he's laid out, that could change as the situation evolves. We just got to go with what we know from the science and make a plan and try it.
Let's see. Yeah, you know, what's interesting is I've been a physician for, gosh, I think just shy of 20 years, and but I was older than the average medical student. I think I went into medical school when I was about 30 years old, or in my 30s. So what I always thought, and so I remember this well because I was an adult when I went into medical school. I always remember thinking, well, doctors just must know. I mean, somehow they must know all this stuff. And so it's humbling. I mean, I've never been surprised at something I don't know, because that's one of the things that I can do as a physician, is I can look stuff up and I can utilize resources. But that's one of the things that's frustrating, is to have something that comes in and is so distinctly different. And I find myself answering questions with "I don't know" more often than I have pretty much in my entire career. And I think, you know, I personally think that's a good thing. I think if you have someone that has all the answers, you probably are listening to the wrong person, because no one has all the answers when it comes to this disease. There was a question, it was kind of an involved question. Hypothetically, if you have been around someone who was exposed, who was originally told they were negative, then was told after the state got the test was positive, and now you're on the 14 days quarantine, and you have underlying health condition. Wow. This is my sister-in-law, by the way. What are the odds of getting sick from this? You know, that's a tough one. I mean, you know, I mentioned a minute ago about the specificity, sensitivity, and can you have false positives, false negatives? You absolutely can have false negatives. There's no question that you can have false negatives. We've had that with retesting, where someone will be retested and they'll be positive. And I say we, I don't mean us at Door County, I mean in general. Someone that I know out of state who is a physician had a patient that was very, very critically ill, and they were negative, I think 3 times, and finally the 4th time it was positive. And they didn't keep testing because it was more a matter of, they were treating it as though it was, which is to say supportive care, but finally on the 4th test it was positive. So we don't have good answers as to why that is. I mean, no test is perfect. But I think the big thing is, if you've gone 14 days and symptoms have not arisen, I think you're in pretty good shape. I mean, usually within 14 days, you'd expect something to show up. And what's interesting is we talk about people that have weakened immune systems or are more vulnerable, are people 65 and older, people that have medical problems, diabetes, hypertension, things like that. And what our limited experience here has been is people that have tested positive that we thought should get quite sick have not. People that are otherwise very healthy and very vibrant have gotten very sick. So it's not a definitive, you absolutely are going to have a horrible course in this if you have a weakened immune system. And again, that's one of those things. We don't really understand why. We have thoughts about it, we have theories about it, but don't really fully understand why. Let's see. Have you read about the studies regarding ventilators and the efficacy of their use? Some medical professionals are saying that ventilators may damage the lungs, and the use of a CPAP machine and oxygen is better treatment. What do I think? I 100% agree with that. That's actually what our experience has been here as well. Is generally, initially when this whole pandemic began, the conversation was about ventilators. We're still talking about ventilators at a national level. Do we have enough ventilators? And my stance has always been, first of all, that the number of ventilators doesn't help you. It's, do you have do you have the appropriate doctors and technicians that are able to use the ventilators appropriately? So that's a big thing. But what we found is people that get on a ventilator who are sick end up dying about 80% of the time or 90% of the time. Which isn't to say that everyone that goes on a ventilator would necessarily die from it, but we certainly are looking for any and all ways to avoid ventilator therapy using non-invasive techniques. As you mentioned, CPAP, PAP stands for positive airway pressure. Looking at CPAP, high flow oxygen, things like that. That's been our experience, and that's what we're trying to continue to do. All right, where are we time-wise? Okay. How long do our numbers have to hold before officials decide we have peaked? I'm not sure I know the specific answer to that.
I'm not sure I know specifically either, although what impresses the state epidemiologist is 14 days of flattening of the curve, which would mean consistent numbers and not increasing exponentially.
So in the Badger bounce back under the Wisconsin's gating criteria, so the things that Wisconsin as a state is going to look for to back off on the restrictions. One is the symptoms, a downward trajectory of influenza-like illnesses, which is kind of what this is among. Downward trajectory of that sort of illness reported within a 14-day period, and downward trajectory of COVID-19 like syndromic cases reported within 2 weeks. So the 14 days really seems to be the key there. So downward trend of influenza type or COVID-like illnesses, and a downward trending of cases over a 14-day period. So that seems to be, then also for cases, a downward trajectory of positive tests within a 14-day period. This is statewide. So hope that answers that question. Let's see. We still have people going back and forth on weekends from Illinois. Is that an increased risk to us, and will the risk increase as we open our doors again? I mean, I guess the simple answer is yeah, that is an increased risk, mostly because, again, that the whole reason that we're stressing that people should stay at home at this point is, again, this is passed by respiratory mechanisms. So if you get in your car, don't leave your car, don't get out of your car for anything, and drive to Illinois and not get out of your car at all and turn around and drive all the way back here, not ever having gotten out of your car, that's probably fine. The reality, though, is that that's not what people do. They get out, they go to the gas station, they go to McDonald's, they get a cup of coffee, and most of the people that do that don't wear masks, and so that's where the risk comes in. So it doesn't inherently have to do with going back to Illinois or somewhere else. It has to do with the reason that we have the safer at home type, not mandate, but suggestion right now. Anything to add about that, Sue?
Well, I was just thinking that because Door County is a tourist destination, certainly the travel concerns us a lot more. And because many people's income is tied to tourism, we really have to be mindful of this. And, you know, we want to open up the community to visitors, but it's not time yet. And hopefully that time will come soon. And when we do, we're going to have to be smart about it. Do it incrementally in steps. You know, one thing about Door County is we're a very collaborative community. Not just public health and Door County Medical Center, but our two agencies collaborate with other county agencies and businesses in the county, and we've all been in conversation over these last few weeks. So when changes take place, it's really important that we continue to collaborate and work together and be on the same page and give the same message. And the best ideas, in my experience, come from collaboration and sharing of our ideas and expertise and experience. So I'm really hopeful that our community can gradually get back to normal and stay safe.
Okay. I think we'll talk about one more question, and I think we're going to wrap it up for tonight. Can people build up their own natural antibodies to this virus? The answer is I guess natural antibodies, no. The reason that this is the problem that it is it's a novel virus. There's 4 human coronaviruses that we've all experienced over the course of our lives that cause the common cold. We do develop antibodies to that, but we still get the common cold because the antibodies aren't completely effective. Our bodies have never been exposed to this particular strain of coronavirus. That's why they call it a novel coronavirus, because it's novel. Our bodies haven't seen this. So there's no antibodies, when they're produced in the body, are produced to a specific pathogen that comes into our system. So the antibodies are produced to that bug. The problem is what you can't just have antibodies that happen to work or that you build up on your own. So when you do get it, you're going to have illness to some varying degree, and those degrees go from no illness at all. Some people will become infected with it. Maybe they have a lower viral load. They won't be symptomatic at all, whereas others will be deathly ill from it. And there's everything in between. So unfortunately, no, you can't. I mean, there's no amount of vitamins or anything that you could take that would necessarily bring up your own immune system, but that doesn't mean that living a healthy lifestyle isn't a help. When we do know for sure that generally speaking, if you're without a lot of medical problems and you're healthier, you probably will do better. And I say probably hedging because there's so much, again, we don't know. Let's see. Christy, can I get Diamox at our hospital? Sure. That's come out in some studies of late that we used to say that, or I shouldn't say we used to say, it has been said that the lung problem that occurs as a result of COVID is similar to what we call ARDS, which is Adult Respiratory Distress Syndrome. And other lung specialists have said, no, this is closer to another condition that basically mimics high altitude oxygen problems. And so the thought is, well, if we treat high altitude, we treat with a medication called Diamox for altitude sickness. And so someone's made the leap, or some scientists have made the leap, that perhaps we could use Diamox, since it treats high altitude air sickness, could we use it for this? So that's also early on. There's a lot of different medications out there. People are saying, well, hey, maybe it would work if this is the case. So, there's a lot. I think we're gonna go ahead and call this quits tonight. I really appreciate all the good questions. Sorry if we didn't get to yours. But I hope this has been informative. I know I always enjoy getting together with Sue every Monday evening and doing this. It really is my privilege to be able to do this with you.
Thank you. And I always learn something.
Well, that's good. I'm glad. Well, and we'll keep doing this as long as it makes sense to do it and people find it helpful. I look forward to the day when we don't have to do this. I would much rather do a Facebook Live like this, talking about some of the other things that we do at the medical center. So look forward to that day. So in the meantime, I wish you all good health. Stay safe. Try and be patient. This too shall pass, and we'll get through this together. So have a good evening and have a great week.